Thank you so much, Uncle. And we actually didn't plan that welcome, but it couldn't have been more appropriate. Michael's also an educator, and I think he won't mind me sharing also a member of the Stolen Generations. And so, yeah, we are going to be talking about some pretty big and emotional topics today. We've already had some emotion on our panel today, and just want to kind of put the trigger warning out for everyone, right? Like, these are personal, heavy topics. If you are feeling emotional, do absolutely what you need in that moment. If you want to leave, absolutely leave. Ben is a real expert in trauma. Definitely come speak to him afterwards as well if you'd like. And if that came out the wrong way, I'm sorry, Ben. So we've got a big, audacious purpose today, and we really want to make this an exchange. So don't sit back in your chair. I want you to sit forward. In the Melbourne version of this, we've got about 30, 40 people online and in the room participating in different ways. So we're not going to be lecturing at you for much longer. Yeah, what is the real purpose here? You know, we at CPD think, like I'm sure everyone in the room, that every child deserves a safe, secure and loving childhood, and that we can build systems and institutions and services that are places of healing and that set children and families up for life. We're going to have kind of two sections to today's conversation. The first around prevention, early intervention and the kind of universal systems that we need to achieve that, and the second around sort of people and place and how we ensure that those systems work for people. So that's roughly how we're going. We've got an amazing panel. I'm not going to introduce everyone because you can see them behind us. But next to me, Richard. I'm so glad that I got to sit next to you. We didn't plan the order.
No need to shout,
but Richard is a senior Aboriginal and Torres Strait leader. He's the CEO, as you can see, of Maari out in Broken Hill. And I have some really incredible insights of what he's doing out in Broken Hill. Georgie Dent is the CEO of The Parent, a really prominent advocate for parents and families. And like others in the room, a member of CPD's Early Childhood Development Council. So it's great to have you here. Angelica is a child and youth advocate, amongst many other things, the manager of the Future Healthy Countdown 2030. And Angelica and I have both been youth representatives for Australia to the United Nations. It's a small club, and yeah, it's great to see you in the flesh, and thanks for all that you've done in youth advocacy circles. And of course we have Ben Perks. It's been a great privilege really to spend the week with you in Melbourne and Canberra and Sydney. As you know, Ben is the author of Trauma Proof. I really recommend it to you. It's an outrageously inspiring, hope-filled and optimistic story of kind of Ben's healing journey from a childhood that was marked by violence. And it provides kind of incredible recommendations and insights, none of which I'm going to steal now because Ben's of course going to do that. But it's really great to have Ben here. And Ben, of course, is also a senior UN leader and has worked on child development and child protection issues around the world, including in Afghanistan, helping to get millions of mainly girls back into school. So we've got a great panel. Now, we, as I said, everyone, please pull out your phones. I really mean that. So there are lots of ways that you can get involved in the conversation, both online and in the room. So take a photo of the QR code right now, if you don't mind, and you can get into the Slido experience. Yeah, we're really going to want to be talking about solutions today, not just admiring the problem. And there'll be multiple ways for people online to submit not just questions, but comments and insights. We want to harvest and harness everything that comes out of the room today. And also those of you in the room, I'm going to pick on some of you. Please put your hand up. So multiple ways to get involved in this policy exchange. All right, so perhaps we'll go to our first poll a bit of a future casting exercise. So you'll be able to see on your phone there. But if in 10 years' time Australia really was the best place to be a child and raise a family, which of the following would have been essential? And you can choose more than one, I believe. So we've got in there at least 1 year of parental leave, paid parental leave. We've got universal access to early education at different ages. We've got maternal health care and evidence-based parenting programs. There's also an other box as well. So please do cast your votes in the room and online. We'll just wait for those results to come up. But I think it's fair to say, of course, that we're setting up some false binaries here, but mainly just to kind of get you in the mood. Obviously, what's important is that these not operate in isolation, but they together form a really coherent early childhood development system from pregnancy to the start of school. So now it looks like we've got a clear winner. Okay, this is more decisive than our Melbourne results. It looks like maternal child health, including home visits and evidence-based parenting programs, is a bit of a winner. That'll be music to your ears then. We'll come back to that at the end of the event to see if people's views have changed. All right, this is most of my talking done, I promise. We might go to the next poll, which is going to segue into some opening comments from Ben. So we've got another poll here. What percentage, now we've got so many experts in the room, you're going to know the answer, but what percentage of people in Australia have experienced childhood maltreatment? So 5%, 13%, 29%, 62%. I hope those of you online are also able to participate and are seeing this in real time. So while those results come up, I might turn to you, Ben, and you can start to explain the results, and some other slides will magically appear. But in your book, you talk about, and in the many meetings we've had, you've talked about how child maltreatment is the most costly but least discussed public health challenge. Can you tell us a little bit more about that as we sort of see the answers to this question?
Yeah, that's the answer. Do you think that's unique to Australia, or do you think that's common around the world? Yes, so there was a systematic review of adverse childhood experience surveys from around 37 countries. The average was about 57% of the population experienced one, and it's a bit different language, but adverse child experience, and between 10 and 20% experience 4 or more different types of maltreatment or family dysfunction. So it's very common, but most people, when they see that, if they haven't thought about it before, they don't really believe it or understand it. Now, if it's very common, it means 2/3 of us in the room have experienced a form of maltreatment. Why is it not talked about or not identified or understood? I think firstly, because this problem, unlike any other problem, unlike most other problems, is hidden in plain sight because of chronic shame, taboo, stigma, traumatic memory, and myth. All of these things suppress this issue. That's the first thing. And then secondly, because of that, we've kind of taken this Angela's ashes kind of approach to child maltreatment, that it's a Dickensian thing that affects 1 or 2 people on the margins of society, very closely associated with poverty and other problems. But what we actually see is that it's very, very widespread. Also importantly, most forms of child maltreatment are unintentional. They're unintentionally and automatically transmitted from one generation to the next. They're on a spectrum of severity. Some children feel consistently unloved and unsafe. Some children feel, occasionally unloved and unsafe, which also is a risk factor, but there's different levels. The good news is that we are the first generation. This is the costliest, least discussed public health problem. I've explained why it's the least discussed. It's the costliest because if you look at any major social public health problem, child maltreatment is often at the heart of it. So 90% of young people in most juvenile detention facilities, high levels of maltreatment. Young people recruited, radicalized, trafficked, groomed, high levels of maltreatment, young people getting addicted for life, obesity, all these kind of different kinds of issues linked to high levels of child maltreatment. And the Secretary General's Special Representative at the UN on Violence Against Children estimates the cost of this is between 11 and 12% of GDP, up to 11 to 12% of GDP. So even if you didn't care about children or families or human rights, the bottom line, the economic costs of this are catastrophic for economic development. They also really harm the prosperity and the productivity of future generations. So there are many different types of arguments about why we should address this, and we can address this because we're the first generation in history to really have strong evidence on how to do so. And part of that is shifting from this focus on response to primary prevention, universal services. The most important protective factor in the life of any child is the quality of relationship they have with their parents or caregiver. We now know how to help parents who struggle with that to have a loving attachment with their children. And we also know how to invest in schools and preschools and childcare and other services to bolster that with strong secondary attachments that also protect children, but also ensure developmental outcomes and nurturing care outcomes.
Thank you, Ben. Thanks so much. And I think what struck me about Ben's work, especially as a parent, was just the normalcy of trauma that you're talking about. And when we talk about maltreatment, it can be your family didn't look out for each other, feel close to each other, or support each other. Or did a parent often swear at you, insult you, put you down, or humiliate you? And I think, it's really changed the way I view this, that it's not, as you say, it's not always those kind of outrageous examples of abuse, but it's happening in the vast majority of homes. And so we're in this section of the conversation now around kind of prevention, universal systems, and what do we do to respond to this problem. And I think we all know that if we're serious about improving outcomes, that we have to start by asking how can we prevent this trauma, and it starts in the early years. And you can see some quotes here from Trauma Proof. So Richard, I'm going to come to you. The Aboriginal community-controlled sector has led some incredible, preventative approaches. Can you tell us a little bit about what you're doing out in Broken Hill at Maari?
Well, around the issue of creating safety and good quality care for early years, that's an area of focus for us at the moment. We're a 30-year-old organisation, so an Aboriginal community-controlled health service, and for us that means we're governed by an Aboriginal board of directors drawn from our communities. We cover a large area. We cover a region that's nearly 300 square kilometres. We're very connected to the Aboriginal community in our region. We've been walking on a journey with them around prevention, early intervention for a long, long time. In fact, we're seeing some of the people that are coming to work for us now, the Aboriginal people, were babies that were born into our service and we cared for them. So we've got very strong connections to our communities, and we employ 2/3 of our staff are Aboriginal people from local communities. So we have strong connection to culture, through our collective identity as First Nations Australians. But our people are connected to communities through family relationships, clan relationships, tribal relationships, language groups, and that's a very powerful resource for our organisation. In terms of what we've done around early childhood, is we've taken the evidence, so there's plenty of evidence about what works, and we've taken notice of it, that we can make big differences if we focus on the early years, because that's a time of when good things can happen for kids, but if they're faced with lots of adversity, that can create lifelong challenges. And Michael, who's a member of the Stolen Generations, I don't know Michael's individual story, but we've learned a lot about the impact of trauma on children through the Stolen Generations We see Michael here as a grown middle-aged man, but his trauma was delivered to him when he was a child. So our services, what we've done is we've taken our early years education services, our maternal and infant health services, and our youth health services, and we've amalgamated them into a single service that we call Murumuru Child and Family. We have an Aboriginal executive leader running that service. But the idea for us is to improve access for Aboriginal families to those services, get better working relationships between people from different disciplines, catch problems early. So we do a lot of the ASQ tracks work, so identifying developmental issues and being prompt about referrals to specialists. Trying to pick up issues in families, parenting issues or family function issues, and wrap supports around those, and build our own evidence base about what works and what makes a difference. And just want to mention that the catalyst for us to make that decision, that was a conscious decision that we made, was to bring those elements of our organisation together, was Commonwealth funding program called Connected Beginnings. So they gave us the catalyst to make conscious decision, and we feel like we're making a difference. We've already got great connections with our community, but we're an organisation that we reflect on what we do. We ask ourselves, are we making a difference? If we're not making a difference, well, what can we do differently? What does the evidence tell us? If we are making a difference, what can we do better? How can we strengthen what we're doing? So that's been our approach. So
brilliant. Yeah, thank you, Rich. I mean, so wonderful to hear an example that is so coordinated, connected up, and supported by the Commonwealth Government. We don't often hear all of those together in one place. Angelica, I might come to you. Where have we seen preventative investment work well to support the wellbeing of children and families in your experience, and what were some of the ingredients for success?
Yeah, such a big question, because there's so many great examples actually that are out there from like a local perspective. I want to, I guess, preface this conversation even with my own kind of lived experience. And so I'm the eldest of 9, so children I'm obsessed with, naturally, but also a young carer as well, and have grown up in a very interesting life marked with a lot of trauma, and some of those experiences, if not all of those experiences, that those numbers represented on that screen. But I guess what I've observed over the course of seeing my siblings, and I is understanding that prevention looks different for all of our different experiences, despite being the same environment, despite receiving very similar kind of, and at times very limited early years support, but at the same time, why prevention should be like multifaceted and thought about in different ways. And so I guess in terms of like examples of where I've seen preventative investment work, I point to one example in particular that I've been recently involved in supporting children, young people who have an experience of parental incarceration. So we know that when you don't have a parent in your life, removed for whatever reason, that is extremely disruptive in many regards, and children and young people, as a result of, I guess, being in contact with this system by proxy of parent or kin relationships, they lose a lot. They lose access, they lose support, especially like young babies, etc. And there's one initiative called Young Prodigy that I use as an example of doing prevention really, really well, but also seeing the investment that's come into doing things in a way that is child and youth led, and also led by families too, and understanding actually that what prevention looks like for this cohort is nourishment across multiple different areas. Nourishment economically, nourishment culturally, nourishment in a sense of relationships, nourishment in a sense of community connection, and nourishment is actually the model in which they use intentionally as the word for prevention, that's what they're focused on. And one interaction that we had at a community retreat was actually with a young person who was also a young mum, and she brought her bub into the retreat as well, and started sharing a lot about her experiences of what she's worried will transmit or translate down to her child if we don't disrupt the system in which she's actually not able to participate in right now. And so what has happened actually out of all of these retreats has been these young people, young mothers, children, all developing like these cool initiatives and ideas that would prevent them from being in contact with the system and thinking about ideas for education, mentoring, etc., like opportunities for connection together. And so I use that as an example of seeing, and that's only been made possible because organizations across government and also philanthropy saw the need to look into this kind of model that was developed with prevention and nourishment in mind. And so I use that as a powerful example of like, I guess, seeing that and the benefits of what happens when you actually work with young families and you work with young people and you work with children collectively as one, not as silos.
Yeah.
And I guess the ingredients is a lovely word because I love that we can be adding more different things in, which is really key. I guess first and foremost would be trying to not do prevention the way that we've done it before, which ignores communities sometimes in their voice. So that's ingredient one. The other ingredient would be already what Richard has touched on, is to understand that there's existing like different cultural models of prevention for a long period of time that we can infuse into the work that we do. The other ingredients that I think of are more so questions around is our prevention efforts just repeating the rigidity that already exists within the system, or are we actually creating activities and initiatives that break the cycle of enduring loss of agency that people do have and do experience? Or another important ingredient as well in regards to that is actually creating systems that center on hope and positive development and genuine support for families across the cycle of their children's lives. So yeah, there's also many other little things, but equity and justice also is another one. I know we often say equity, but justice is equally as important in prevention efforts. If you don't have the two together, can it truly be preventative? Yeah.
Yeah, thank you so much. Thanks. Love those ingredients. And we're coming to all of you, both online and in the room, straight after Georgie. So get ready. We want to hear your comments, your questions, interventions. So please get ready, but also listen to Georgie. So if we move sort of from prevention to universal systems, obviously part of the same thing, but you know, what's the impact for parents and caregivers when they can have access to universal, high quality connected services?
Yeah, thanks, Andrew. And I think that, as you said in the intro, I run an organisation called the Parenthood. We're very interested in policies that support parents, because we believe that if you don't support parents and caregivers cannot support the children in their lives. And I was sitting here listening to you, Ben, and looking at those statistics thinking, we know that when a parent or a family bring a baby home for the first time, it is the most radical life transformation that ever occurs. And we assume and expect that the parents and caregivers have got the ingredients they need to give their children what they need. And there is so much of this unspoken, just this assumption that somehow you will take your baby home and you will know what to do. Sometimes that's okay. But a lot of the time, and if you look at those numbers, that tells us a story that for the vast majority of parents, when they're bringing, babies home, they're not necessarily equipped with the supports, with the services, with the resources they need. And I loved what you said, Angelica, about nourishment, because it's sort of like, in my, when I think about what universal services might look or feel like, it's parents coming home not feeling completely overwhelmed before they even get home. I often talk about the fact that it's amazing that we have normalized parent and birth education. So a lot of new couples will do some form of antenatal education. In an ideal world, the birth of a child will represent a marginal percentage of your experience as a parent, but you've done education for that moment. And then it's a very common experience for parents to be like, but now I'm taking the baby home and I don't know what to do. And we can joke about that because on one level it is this sort of universal experience that you bring home a baby that has no manual. But we actually do have a lot of information. We do know what sort of services and supports help parents in those early years. And I think if we had a sense of parents leaving wherever it is that they give birth with a sense of knowing where their next port of call is. And it's not necessarily that they need it immediately, but if they know there's a child and family health service, if there's a hub, if they know that at their GP clinic they've got a baby clinic, if you know what your next port of call is, it makes that part of the journey less isolating. And then I think about that over the stages of the early years. A lot of parents don't know what they don't know. And that is part of what makes parenting quite, it's a profoundly challenging experience because you don't know exactly what is meant to happen and when. You might have a vague idea about what the milestones are, but we know so many parents have got children that present with challenges and the parent doesn't know, is this something that's I need to seek treatment for, or is this just normal? Families are sort of muddling away doing their best without necessarily knowing how and where they can get the support they need. And in my view, universal services that are connected is about providing that pathway without a parent having to go out of their way and find it. But it's in their community, it's accessible, it's available, they know where it is. And that isn't going to look the same in every community. But I just imagine if parents felt held in that way, that they knew there was help available and they knew where to get it when they need it.
Yeah, brilliant. Thank you, Georgie. Yeah, really powerful words. So I want to hear from all of you. So we'll get the slide up again as well. Would love to hear some comments, online in the room via Slido if you want, in terms of what have you liked that you've heard, what have we missed, what are your insights? But also want to hear from some people in the room as well. So please put your hand up. We've got some roving mics. We'll take sort of about 3 interventions at once as well. So hopefully everyone's got access to that Slido. We'll start to see some of those comments on the screen as well. So even if we don't address all of them, rest assured we'll harvest them at the back end, and the panel will be able to read it all on this big screen we've got here as well. So yeah, who would like to say something in the room? Come on, we've got 2 big mics here. We might pick on some people. So
Hand over there.
Yeah, I know these people. Hang on, Ryan, just 1 second. So we'll come to you, Margaret, as well. But I just want to see some other hands as well, and we're just going to take a round. Yeah, great. All right, okay. And I'm going to pick on some people as well. So let's go, Margaret, and then I'm going to pick on a few others as well.
Thank you so much. And I was.
Do you want to introduce yourself as well?
I'm Margaret Piper, and I work in the refugee space at policy level. Georgie, I was thinking as you were talking of a comment that was made to me by an African father who said, but if I can't, they tell me I can't hit my child, but I don't know how to discipline him. And this is, to me, something I encounter so often. People who come from other cultural backgrounds, who are told what they can't do when they're raising their children in Australia, but they don't know how to adapt to the cultural expectations, but they also don't have their village around them. They don't have the support that they would traditionally have had. I would be really interested in your comments on this, but also Ben's, because you throw into that the impact of trauma on parents and how this impacts on their confidence in engaging with societal institutions.
Thanks, Margaret. So if you can hold on to those, that'd be great. Maybe we'll go to yes. And then I don't know, looking at you guys, Leslie, I'm also looking at you. Anyway, yep, go for it.
Hi, thanks everybody. My name's Sophie Bruce. I head up the Centre for Relational Care. Richard, I love what you've said about Maari. I think having those kind of organisations that provide relational glue in communities is just so important, and keen to learn more and more about that. I guess the question I've got for anybody who's keen to answer this is, there's a lot of talk about what we want government to do, or what we want, how we want to influence policy. I'm also interested in your thoughts about what's your ask of communities when it comes to healing and relationships. What do we all need to do in our own communities to support this, beautiful goal of Australia being the best place to raise a child and family. Yeah, interested in your thoughts on that one.
Thank you, Sophie. Where did we end up over there? Di, do you want to come in? Maybe Di and then Leslie. I think you're on. Yeah.
Sorry. I just had a quick thought about the 62% and the saying that we parent the way we were parented, and how do we break that cycle? And Georgie, you're talking about a port of call, which is great, but how do we go even further upstream to give parenting classes and education before they go home, before they even have antenatal? Where does that come into play?
Do you want to just introduce yourselves all?
You want me to go now? Okay.
Who are you?
Oh, I'm Leslie Lobel. Sorry, I'm Leslie Lobel. It's great to be here. Thank you. Ben, you talked about how this is an intensely private and hidden tragedy. So my question kind of goes to, do we have a disconnect between this intense, hidden, private challenge and the alphabet soup of programmatic response that we tend to think will solve the problem?
Thank you, Leslie. Leslie's also the chair of our Early Childhood Development Council, which is meeting tomorrow. I've seen a few other people. Can we just have some quick fire responses? And we're also going to have a look at some of this stuff and we'll get back to other people as well.
Margaret, I'll just say, I think you're exactly right. And I think that skill gap of, there are more and more parents who know what they shouldn't do, but parents are not necessarily equipped to know what they should do. And the truth is, it's hard. And it does take support and skills and strategy, and that takes time, and that needs, and I think that you are right to pick up on the fact that there are going to be cultural sensitivities and circumstances where that's even more difficult. But I would say that in the vast majority of households, there is that tension between sort of knowing what they shouldn't do and not knowing what they can do. And I think it's exactly that point. I know Bernadette Black, who I'm sure some of you are familiar with, brilliant. Her and I were having a conversation late last year where she was saying how in, I think it was Finland, or it might have been Sweden, but that the 20-week scan, wherever that happens, it's a point of contact that is almost universal. And that's when the allied health or health professionals start having a conversation about what going home looks like. So after the baby arrives, and it's really about setting up that expectation and setting up the things like, this is what it might be like. What are you thinking about home? And I think that those sorts of things make a huge difference.
Yeah, so great questions. I think that one of the things about a conversation with parents about discipline from any culture, because it's cross-culture, is that when parents learn positive discipline, the outcomes and the relationship is much better. And, I was recently at Oxford speaking to a colleague who's a professor really of parenting, of parenting programs and how they work. And I asked her, I think I put in the book, I asked, if you had to give one piece of advice for parents about discipline, what would it be? And she said, play at least 15, 20 minutes a day, because it switches, and play on the floor with your young child. Get down, be led by them, free play. Because it, well, you know why, because you're all experts, right? Well, many of you are experts, but it changes the relationship with the child to a collaborative one. The people that have grown up in environments when they didn't play, I didn't play as a kid. I was in a children's home, I didn't play. And so for me, becoming a father, I had to learn to play. And many people are going through that change. So I think it just pays dividends in the quality of the relationship. And the WHO systematic review on parenting programs shows that 435 randomized controls trials all around the world shows not only improves outcomes for children, prevention, nurturing care, language acquisition, it also improves parental mental health. And so parents feel that because love heals. If you have the skills to love your child, love heals. The next question, the ask of communities, the most powerful thing we could do. I was speaking to the Minister in New South Wales, Minister of Children today, and I said the most powerful thing that we could do as communities is just release the valve, right? You have a conversation in every community about child development and child protection as two interlinked things, not as services, but as the neurobiology of the child and the relationship with the parents, and take the judgment out of parenting and the shame and roll back the taboo. We've done it before on domestic violence, on menstruation, and many different things. We can do it on this issue. There was a question about the other thing that we talked about, and we were in Victoria a couple of days ago speaking to the whole health sector, and people were saying, well, we try parenting programs with people in 3 or 4 years of age, and they don't, for some, 20%, they don't work. But why start at 3 or 4? You need to start during pregnancy. The 20-week mark is a good mark, and having a conversation with a parent about the strategy for the child. What's the parent's strategy for the child? Most parents won't have one, but if you ask them what they want their strategy to be and help them to devise one, so it's consistent care. A lot of maltreatment occurs where there's inconvenient behavior in the moment and the parent has an ad hoc response to it. So I would say the most important thing to do is to front load parents or start parenting programs during the perinatal phase. Is there a disconnect between the fact that maltreatment and all of this stuff happens in what I think Zadie Smith calls the realm of the unspoken, and then services are so complex and stop and start and fragmented and everything everywhere all at once? Yeah, you need to have a conversation about love and belonging and an authentic conversation. Policy conversations are often very wooden. When I wrote my book, I went to the publisher and I said, I want to write a book about policy and preventing child trauma and child maltreatment and how we're the first generation that can end it. And they said, yeah, but you need to have an authentic conversation about healing and people's emotions and love and all of that. So then I did lots of storytelling. And I think that's what we need to do at a policy level as well, to meet people where they are. These are deeply human, complex, nuanced individual things that need a realistic conversation and an engagement. And that's what we need to be able to do to devise the services that will meet the needs and address the issue.
Can I just add just something quickly? Those conversations should also not be when they 100% agree in terms of conversations about like what love, what connection, what relational care actually looks like for different communities. And I guess the role that we can play as communities is to, one, provide the spaces where we can do that. I think that should be, really governed by community. I guess the kind of other thing that I think of is that a lot of these conversations, there are communities who naturally talk about this anyway. So when we're going and we're having these conversations, we should also be, one, aware of, and I'm thinking of, again, from like just all the knowledge that exists from First Nations communities about this. Like it's just already like the way of talking and the way of being. Same with my community, like being Nigerian, like we do talk about these things. So like providing the space where like that can be like acknowledged as community. And sometimes we pretend like communities don't also have silos too. We should actually look at what is the silos that exist at a community level and how can we actually break them down as well. That's the role of community to really do that too, because the silos that exist in the system are very much so at a community level. I was just like out at Liverpool Neighbourhood Connections recently, an amazing place that just, again, gets community, provides the space for different groups, parents, young, old, etc., to come together, but also to acknowledge that that there are differences that exist amongst like this community, but we're going to provide a safe space that removes the stigma of being Liverpool or 2168, and it just be a space of love together. That's what really should be, again, at a community level, we could do that a lot more. And I also love that relational care is what you work in, because that's more of that needs to happen across the board.
Thank you. Georgie, can I put you on the spot? That top question up there, do you want to have a look at that? Because it's been the top voted on Slido. How do we ensure our universal systems are actually universal by embedding the equity and justice lens to ensure families? There are also some other questions in there. How do, universal support further down, Kunal's question, universal support versus targeted support. We haven't talked so much about universal services. Do you want to try and take that in a minute or two?
The top one?
Yeah, yeah.
Well, I mean, I think that. Oh, hang on.
Has it
Which-
moved?
Yeah, it did, but,
Oh, no, it moved.
oh, no, now it's the second one. How do we?
Oh,
support
no,
our
get
universal
outvoted.
systems? I think there is this sort of notion that universal has to mean uniform. And I know that there's a reason for that because it might be easier to just roll out a uniform system and everyone's got the same. But the reality of a universal system when we're talking about policies to support children and families in the early years, it cannot be uniform, not in a country like this. And I think how do we ensure that? It's by designing the policy intentionally to be meeting children and parents in community where they are, not saying we're going to impose this service will be available, but actually designing it with the communities it's designed to serve in mind.
And they've got to be able to have access to it as well, right?
Well, yeah, it has to be, in my mind, I mean, I often talk about primary schools when I talk about a universal system where it's in your local area. I do know we live in a very geographically remote country, so there are parts of the country where it's not easy to get to a school, but for the vast majority of the population, there is a local school and it's near where you live, and you know where it is, and your child is entitled to a position there, no questions asked. That to me is universal. It's in the community. It's there when you need it. Families know it exists.
Yeah, brilliant.
As a principle.
Yes, yeah, great. Richard, I'm going to come to you. Equity is important. There were some other people who had their hands up. Can you just sort of show me if your comment or question? Yeah, okay, all right. Maybe let's just go. I mean, we're running short of time. But let's just listen to these three people. We're not going to be able to answer it immediately, but it'll just be great to get your comments, perspectives into the room. Yeah. So Sam, and then this lady here, and that lady. Yeah.
Thank you.
Yeah. So. Go on.
Is it me?
Yes, it's you.
Hi, I'm Sam Page from Early Childhood Australia, and thank you to the panel. It's been a terrific conversation so far. I really think we need to avoid setting things up as dichotomies like, oh, do we have child maternal health or playgroup or preschool? We need all of those. We need a mix of models. We do need to be, there's a question up, we do need to be fiscally responsible. We can't just write an unlimited check, but we can say there is an evidence base for all of these different programs. It's not one or the other. It's not paid parental leave or high quality early childhood education and care for children under 3, because some families need one and some families need the other, and most families need a bit of both. And so I think we need to tell the story better about the mix of supports for families that's required, the flexibility that's required so that those services don't all look the same and are adaptable to different needs of different families. But I think the other thing I just wanted to say is, my background before I was in early childhood education was in family services and family support and prevention. And the conversations we were having 20 years ago were how to give parents confidence in terms of managing children's difficult behaviours, having dinner together. I remember an international prevention expert making a very strong evidence-based case for the fact that having a routine, having dinner together, having a dining table, sitting down at the same time with your children was one of the most significant changes you could make to your household to prevent future problems and to build good communication with your children and prevent a whole raft of problems in adolescence. But we don't tell people. It's almost, I feel like we're almost being negligent by not telling people that these are the sort of simple family routines that you can establish that set you up good parenting relationships. Play is another one. If families are uncertain about play, that is something we can fix really quickly with some really good public education. But there's a reluctance in Australia, I think, to weigh in on that or to do public health type campaigns on what parenting and good family rituals and routines look like. And I think we could be doing a lot more of that.
Yeah, let's just move over. So it's this lady here as well. And you, yes, yep.
Okay. Hi, I'm Juliette Bennett. I'm from the University of Sydney. I get a bit nervous when I'm asking questions, but thank you very much for your talks. I'm really interested in how you think we can design the structures better. For example, I've interviewed lots of parents and they're under so much pressure, particularly time pressure and financial pressures. My research is in relation to providing food for the family, and they're very much up against these the commercialization of food that really works against healthy eating. So they're up against pressures, and the focus is so much on parents are responsible for this and that. And so I guess my question is, how do we use other community sort of facilities such as schools? A lot of countries are providing food, which relieves both time pressures and the pressure to parent food and healthy eating. So I wonder where is, the timing that clashes 9 to 3 and 9 to 5 working hours. How do we have some of those interventions to support parents?
Go for it. We're not going to be able to respond to these, I'm afraid, right now, but let's harvest it all. Zoe's going to do a wrap as well. We're recording all of this, so all these interventions are useful in different ways. Yes, go for it.
It is on, I think. My comment will actually tie quite nicely with that. I'm Kayla. I work in the Australian National University, but within there, I'm working in the Children's Policy Centre. So the program of research, which is our main program research, is More for Children, which is understanding children and their families' experience of poverty in Australia. And we've worked in 4 communities throughout Australia now. And I think, again, that issue that was pointed to, and as a few comments on the board are also saying, there is, I think, a broader issue here, that like a deep-rooted issue that is poverty. And I know that some people probably don't like using that term. That's something that I've struggled with coming here from Ireland as well. But I really think that until some of those issues aren't addressed, like it's going to be very hard to get to parents often then don't have the time to play with their children, or the stress that parents are under. And we've heard that a lot from parents in terms of navigating systems and Centrelink. That means they snap at their children, and then we're hearing it from both perspectives, but it's not actually a lack of love, which is often what it looks like. It's just trying to navigate those really complex problems. And I think that there is like low-hanging fruit that we can get to. I think some schools are doing amazing jobs. We worked in a school recently that was providing 4 meals a day for children, as well as a food pantry, as well as washing services, everything. But that's only going to patch a problem. And I think that we are actually patching a lot of problems quite well in Australia, but we're not actually getting to the like deeper rooted issues, which means that 20 years ago, you probably were having similar conversations. So
Yeah, thank you. Thank you. I'm just going to keep moving us along. I'm sorry. So Kat and Adelaide are just going to quickly talk to you. CPD's done a lot of thinking on prevention and universal systems. So they're just going to talk through some of the recommendations and ideas that we're sort of working on in this space. Thanks, Adelaide.
Thanks. So CPD's policy work and recommendations are really designed to look at how to create a system where Australian children and families can thrive, because we know that when governments invest early and work alongside families and communities, everyone benefits. And we aim to do this through 2 sort of parallel approaches. Firstly, we develop specific practical policy reforms that government can do now to make tangible improvements in the lives of children and families. So that's specifically looking in areas of child and family health or early childhood education. Secondly, we actually work to change mindsets. So that's how decisions are made across government, how economic priorities are set, how funding is allocated, and how success is measured, so that the well-being of children and families becomes the central objective of policy and investment, as opposed to looking at things like GDP and growth. And these 2 approaches are mutually reinforcing. So stronger social services demonstrate the value of early investment, while reforms to government decision-making create the incentives needed to sustain those investments over time. And prevention is a core principle that underpins both of these approaches. And by prevention, we mean decision-making that is long-term, preventative, holistic, and participatory. And these are the principles that CPD uses to describe what we call a well-being approach. And really to make sure that investing early in children and families becomes common practice, systematized and sustained, we really need to make sure that government decision makers at all levels across all departments are incentivized and encouraged to do so. And CPD makes several recommendations for how to do this. So these include reforming budget rules to account for later savings and revenue caused by early investment. And that can include looking at cost savings up to 25 years into the future. And that incentivizes the development of proposals that do focus on early intervention and prevention. Secondly, we have recommendations around establishing what we call avoidable costs units within treasuries that can track and measure long-term investments through and the savings through those early intervention and prevention focus. And thirdly, actually expanding our conception of prevention and prevention frameworks to really capture the structural conditions like poverty, income inequality, housing affordability that are key drivers of demand for those services. And I'll hand over to Kat to talk about.
Thank you. So we really see that these sort of structural changes that we make that really help support when we're thinking about the delivery of that service environment. And so we work really hard to think about, and it's amazing. I don't actually think there's anything I'm going to say here that somebody hasn't already said in the room. So we are advocating always for an integrated, progressively universal early childhood development system. So we have sort of three key platforms, and going to Sam's point, it's not picking between them. We think that all of them are absolutely critical. So it's around the 12 months of paid parental leave for parents so that they can spend that time in that first year with their families. It's about access to high quality early childhood education and care, and access to high quality equitable services across the health system. I had a really great meeting with Ben this morning where, as he said, it's actually the health system that's at first contact with families, and really thinking about how we can leverage that to really be supporting parents throughout their journey. And then the other service systems we have. But we really think about this as this is an integrated suite of support that families are given, that this is really thinking about the children that are there. It's, as Georgie said, universally is not uniform. It is thinking about the needs of those children. It's providing the services that they need that are wrapped around those children and those families. We really think, again, going to, I think, Angelica, you were talking about community, right? And so it is about thinking about communities and having that designed for communities. And Richard, you so beautifully have been talking about the Aboriginal-led is so important. It's about delivering those culturally safe and supportive services. And so for First Nations communities, that is really important.
Thank you. Brilliant. I'm just going to move us along. There's lots of energy in the room. We're going to have another chance to get to people as well. And also feel free at any time, you can put your comments into the Slido as well. But yeah, so we've established kind of prevention requires strong, connected, universal platforms. So how do we make sure they're shaped by communities? So we're just going to move into a bit more of a people and place kind of conversation. So we've got a great question for you here. So if everyone can pull out their phones, even if you are in the room, because we're not going to be able to hear from you all with your voice. This is a great question. Where have you experienced the service? Here we go. Where have you experienced the service or support that prioritised relationships and built trust, particularly for families and children? We were having just this conversation this morning with the Minister for Children and Families. And critically, as Ben would say, how did it make you feel? So please think about that. It's an open text. You're going to need to type into it. But all of these lovely answers are going to start flowing up. So where have you experienced a service or support? So that's really what we want to go into now. What would it take to build systems that prioritise relationship, build trust? And so those answers should start coming up. Here we go. So Susie, GP, yes. Long-term relationship for mum and kids. Kids felt understood and cared for, reassured. The local library, James, that is such a good point. I know it's one that Ben and the Governor-General feel very strongly about, especially for recently arrived communities and others, that people feel trusted and heard and safe. Primary school, Zoe. Is that you, Zoe, or another Zoe? No, it must be another Zoe. You're anonymous. I mean, I agree. Like, primary schools are so good at building community. Early learning centres, absolutely. Aboriginal community-based services, childhood nurses, local sporting clubs. That's another one that the Governor-General Canal is really big on, local sporting clubs. Integrated child and family services, Elizabeth, absolutely. So we're seeing a lot of early childhood centres coming up, which is really positive. I know my early childhood centre is incredible. Yeah, that's okay. Do watch out for the glasses. That's the third one that's been hit. I don't think we've had a breakage yet, but the floor is lethal for glasses. Yeah, you'll see all these coming up. Richard, I'm going to turn to you.
Yep.
to kind of build on your earlier comments. So in those very regional remote communities, can you tell us a little bit, what does it actually mean to make systems work for those communities?
Well, I'm just drawing on our experience at Moranbah, so I can't speak for every Aboriginal community, but or even the broader community. But I think there's some things that principles and ideas and concepts that people can learn and how we've applied them. So what it means for us is that we exercise what we call self-determination. It's a pretty common term that's used in Aboriginal affairs, closing the gap and all of that. So we've consciously worked out the way we describe it. We call it the Murima way. And what it means for us is that we have models and designs for our services the way we want them delivered. A big part of all of our service delivery, because we do more than just early childhood, we do chronic disease and a whole range of other things. But they're built off a really powerful, I think it's a very powerful governance framework, which includes cultural governance alongside strategic governance, alongside operational governance, alongside clinical governance and professional governance. So, but cultural governance is really powerful because we draw it from our communities, we draw it from our board of directors who are all elders, Aboriginal people. We draw it from our Aboriginal staff. I have about, I think, 8 or 9 senior Aboriginal leaders in my organisation, and been with our organisation for a long time, well connected to the communities. So we prescribe what our model is, how it's going to be delivered, and when people come to work with us, we orient them into our organisation, and we tell them, this is if you're an early childhood educator, this is how we expect you to work within our organisation. We've worked really hard on creating a very, I think, positive workplace environment. So we've worked on our workplace culture. So we want it to be safe. We want it to be welcoming. We want people to respect each other. We want people to commit to our values and what we stand for as an organisation. And we want people to, particularly non-Indigenous people coming to work in our space, we want them to be curious about our community and the behaviours that they see, rather than judgmental. We ask people, we say to people when they come and work for us, if you're coming to work with us for a short period of time or a long period of time, it doesn't matter. But when you start here, between the time you start and the time you leave, what we want to give you is professional and personal development, the opportunity to develop professionally and personally so that you are a better version of yourself than when you came to us. So we kind of do a lot of talking and thinking about that. And we're very upfront in talking to people about that when they're looking at coming to work for us. And the reason we've done that is because we want to find the people out there in the system, whether they're a general practitioner, a nurse, an Aboriginal health practitioner, allied health worker, whatever that professional is. We want the people that are going to be a good fit for us, and we're going to be a good fit for them. So we try to be very clear about what people's expectations are when they come to work for us. So that's, and that's to me is what our self-determination is about. It's very place-based. It's designed for what works in our region and our communities. And in early childhood, the strong point of connection for us is through our early years playgroups. That's well attended by all parents, grandparents, people in the community. Kids love, families love their children. And so we treat that space as a sacred space. We respect the rights of children in that space. They have the right to they have the right to their culture, their identity. We celebrate that. But they also have right to their own privacy and confidentiality, because we do have kids who are part of the out-of-home care system. So we've got to protect that. So that's what I think people
Yeah,
might
great.
learn from us
Yep.
is don't be frightened of things like cross-culture and environments, because I think there's we have a lot more commonalities and common ground than the differences might make us believe. I think what I've heard from the panelists here, everything they've said has resonated with me. I see it in our communities, but we've got our version of it and what's going to work for our mob and our region.
Yeah, brilliant. And playgroups came up a lot in that list as well. So I think really, really important. Yes, Simon and Martin, I might pick on you shortly, so I'm just giving you a bit of a warning. Angelica, you talked earlier about the importance of accountability, right? And that systems being accountable to the people they serve. What does that, do you want to give it more flavour about what that accountability looks like? And obviously, if there are other little questions or comments you've heard that you want to address as well, go for it.
Yeah, I think I'm so glad on that list of, I guess, questions and the comments from the floor that like the root causes and actually understanding and addressing that within the system is something that we need to have an honest conversation about well, not even just an honest conversation, actually just a response period. We've had a lot of conversations. I think we hear a lot about the root causes and drivers of the structural inequities that exist within the child and family, systems, sector, environments, and practice. But we're not going beyond just like the root of the root causes or the drivers of the drivers. Things to do with. I think there was a great. I think it was someone mentioned like navigating systems and even just Centrelink or access to things. Why is that? Or the inequalities economically to to getting information as a parent or for families, etc. Why is it the case? The root cause is discrimination, racism, classism, the things that we're not understanding that our policy is still not getting at. And so I think that I really love that that's been brought to the conversation around how can we start to think about these root causes within how we draw up or reimagine policy or practice in a way that is all-encompassing for families and for children, and really echo the sentiment around poverty 110%. The fact that we don't have any national data on poverty is, I think, something that's kind of inexcusable, in my opinion. But that's, yeah. I guess to the question around accountability, accountability, I think for one, I just want to kind of preface we should start to realize that people aren't just, and families aren't just at service to the system. I feel like that's what it could feel like for a lot of children and also a lot of young people, a lot of families. And so this is why accountability is so clear. And I guess accountability in some of the work that we've done in Future Healthy Countdown, last year wrote the first progress report, which is just tracking 22 measures across 7 domains for children, young people's health and well-being. And they're all things that if you're familiar with RACI and their amazing work, a lot of those domains are based off their work, but also what children, young people, and policymakers, etc., have said are the measures that we should be looking at. And to see in those 22 measures that most of them didn't have the best data available, most of them didn't have great national or even state level or local targets. We talk about the domain of being valued, loved, and safe. We still don't understand that well at all. And I know I'm in an audience of people who might go, not data again, but kind of to Uncle's point in his welcome, we do need to actually reconsider what type of measures we have when it comes to health and well-being for children and families. Are they strengths-based? Do we have that at a national level? Well, we kind of don't. We don't actually know how many children feel loved. We don't know how many children actually feel valued and cared for. We don't know how, again, the poverty picture as well and material deprivation, but also material thriving. What does that look like nationally for families? We don't have that information. That's the accountability gap. And what we've tried to write about last year was that actually we need to look into this gap. One, data can be part of this conversation and actually developing a greater picture of and collecting that information in ways that actually reflects proper community I guess, research or, consultation, etc. So that's, I think genuine accountability comes from actually understanding the full picture, but then responding to it as well. What policies are in place that actually recognize these gaps? And I think, children, families and young people that are constantly talking about systems actually being responsive to their needs, going beyond just voice, going beyond just, having I think someone said an ABC soup of things. We need to go beyond just that, but actually what is the flavor of the soup actually infused with the perspectives and the reality, the ingredients, that actually the culmination of that, does it actually reflect this community over here, this community over here? Does it not? How can we adjust that? That's genuine accountability to me. And I think also community in the broader public wants this response as well. In the report we got, we collected community sentiment data around the policy actions we have for Future Healthy Countdown. One of them is around home visits and that actually being a policy action that we need to have greater action on nationally. I mean, there was massive support in the community for that. I think the survey was like almost 10,000 people, so like a really nationally representative sample. Why aren't we responding to that call for action for community? Where does accountability lie if that's the need that our society is calling for? Anyway, I've said a lot. I think accountability really is something foundational to what we do, and seeing children on the picture nationally, in state and locally as well needs to happen for there to be any actual movement. Anyway,
Thanks, Angelica. Thank you. We might just go to a final round of kind of comments and input from people online and in the room. So have a look at that Slido again. On this kind of topic of more local people and place, hopefully we can reset that from the last round, but I think that new comments and questions will come up. So yeah, please do pull out your phones. Really interested to hear your comments and questions. Martin and Simon, I thought maybe we could hear from you. You don't have to. Oh, you've got microphones. Great. But you guys have done a lot of thinking on people and place. Simon, perhaps you can also introduce where you're from.
Sure. Thanks, Andrew. And speaking, of course, because I'm told, and politely respond. My name's Simon. I'm from the Investment Dialogue for Australia's Children. What's running through my head is two really different pictures, and I'll out my privilege here in this comment. But thinking about the topic, the best place to raise a child and a family, I think about the experience of my son, who's 5, the incredible access he's got to ECEC, the development that we saw in the 2 years before school, where there was engaged educators that had been there for 10 years and a highly engaged service linked with allied health support and a range of other things. The school transition that he experienced, 5 weeks of transition in September before he started, a buddy that helped him along the way, and then speeches, other allied health accessing that transition period. The Greenway coming into the local environments, making it like Bondi. The activity through the inner west is incredible. A picture of a space where it's really privileged to raise a child. And I think about the local fruit shop, and the way in which my son will count fruit when he goes there and gets free grapes and feels engaged. When we think about some of the spaces that we're most happy with to raise a child, the local fruit shop is also important. And then I think about, in a very different space, some of the communities that we are sitting down and working with to see how we can achieve change together. And some of the foundational things put on the table there are, one is transport. There's an economic hub 10 minutes away, but can't get there. It takes an hour and a half to get there on the bus because there just isn't the access to get there. We think about the physical infrastructure. There's no places for kids to play. And that space to engage and so on isn't there. The hours when school ends to when work ends, there's nowhere safe for kids to be. Those spaces aren't activated. and so on. And so that after-school experience is one of threat and danger for too many kids. And so we think about all of those things. This is the sort of richness that we get when we sit down and listen to communities, that things that often don't appear on the books of national reform, like the spaces to play, the local infrastructure, the transport, but then also, of course, the joined up and connected service system are all incredible pieces, but really need to be unearthed from what's happening locally and then thought about how do we design that system really effectively with those local voices. And I think, and I want to highlight that because right now in this country, we have an incredible moment of reform where we've got billions of dollars going into the ECEC, which is fantastic and we all love. Thriving Kids is coming, and we hope it will do good things. We've got things like reform to the family and child activity, again, very large amounts of money, and state governments, of course, are doing good things as well. And if all of that delivers 55 or 60% of all of our hopes and dreams just within those line items, I think we'd all be pretty happy with that. But the reality is we need layered and coordinated responses at the local level to bring a lot of these things to life and to activate local communities to drive prevention and build pathways that are really fantastic for children and families. So that comparison for me just really came out of this conversation and think about what would we really want for communities across the country.
Thank you, brilliant. And IDAC's a really important initiative. Do you have a microphone, Martin? No, you don't. There we go. And then Ryan, can we get one to Susie as well?
I do now. It's all right.
Great.
I do now.
Susie, do you want to put your hand up so you can get a microphone?
Hi, Martin Stewart-Weeks, a former board member of CPD. So a practice fellow at the Australian New Zealand School of Government, which is something that interests me because both of the CPD lines of inquiry around policy making, decision making land very squarely, in my view, about the mindset and frames of reference that are inside the heads of our senior public leaders, for most of whom this is a conversation that's very hard to process. So my anecdotal, I just have to tell a quick, small personal anecdote.
You got 1 minute, Martin, so.
Okay. So I went to English boarding school at the age of 7.5 in the 60s, a period which was considered to be a perfectly normal thing to do. But whenever I'm looking for sympathy now, I just put that story out and I get floods of it. And people say, how on earth did that ever was allowed to happen? Anyway, just putting that to one side. I want to go to Ben's point, and by way of a story that Charlie Leadbeater, the English writer and thinker about system change, talked about Karen McCluskey's work battling knife crime in Glasgow. And she didn't make any headway until she started to convince people, particularly policymakers, to think about the problem as a public health issue, not as an issue about angry Scottish young men beating themselves up on a Saturday night. And part of our difficulty, and Ben, you may want to comment on this, is that it seems to me we present many of these policy issues, we bring them into the policy system without recognising that for many people in that system, they literally can't process what you're telling them. Yeah. They don't know how to put the pieces together, and then to start talking about the need to show, a bit more empathy and love and all those kinds of words. It's like, what? Yeah. I'm a policymaker. What's the frame of reference here? You tell me it's a public health issue. Now I'm with you. Yeah. Now we can get really complicated and subtle and nuanced. So I'm just wondering whether we are not giving enough thought to the way these conversations are heard in the systems we're trying to influence. And the answer is, I suspect we don't. Thanks.
Thank you, Martin. Susie, and then we'll come to the panel.
Hi, everyone. Susie from the Smith family. Thank you for a fantastic discussion and engaging way of doing all of this. I'm really curious about complexity, and it's Angelica's point around data as well as a framing question, that we know we don't need uniform in order to deliver universal, and we talk about proportional, but we know that at a systems level, when we try and do needs-based and we try and do proportional, we're kind of a bit fuzzy on how do we really identify the level of complexity in order to have proportional solutions and services and wraparound support in communities and for children and families. So were we to think about implementing a bunch of things around parenting and home visits and child maternal health and transition to school and all these wonderful things, can we get better at what is it really going to take for those who are experiencing the most complexity, and how do we direct much more resource to that end, rather than on average it's going to take this, so we'll just provide that everywhere, and then a lot of people continue to fall through the sieve.
Thank you. So people are getting a little hungry. Lunch is waiting out there. This has been an exchange, so I hope people haven't been frustrated if we haven't answered all of your questions, because it was never designed as a Q&A, right? It's designed as us to learn and hear from you as well, and for us to hear and see other people's comments. So one intervention and comment from all of us, and then Zoe is going to wrap us up. And then please do stay. We're going to have lunch together. The idea is we continue the conversation over lunch as well. Maybe we'll save Ben for last.
Okay.
And we'll just work our way down here.
So me first.
Yeah.
Yeah, look, really interesting listening to what people are saying. Just want to pick up on, you talked about poverty, and you just talked about complexity. I think our work, what we're doing, which I think is really good, really good. It's working with communities where they're at, meeting them where they're at, listening to young people. The median age in our community is 23, so young people should have a lot of confidence about they should be heard. So, but I think in spite of all that good work that we're doing, we still struggle with, a third of our community live in poverty. We have lots of complexity in some of our families. We see probably 95% of the children and families in our community in Broken Hill, but there's still this crust of people that just do not engage, or that services cannot engage. So, and that's a mind shift, a shift that we've made now, thinking is that these people aren't hard to reach. It's us who have a problem in engaging them. So, so those issues and problems are still there, but this work we can do around early childhood and the evidence that's available, and the opportunity to be flexible and respond quickly and early to problems that present, we still want to do that really well, but it doesn't mean that we've solved poverty or those other things yet.
I think I'd probably just make a reflection, and this has certainly come up in a lot of the comments today, that we have to be realistic about the context in which children, parents and families are living and trying to survive. And I think that we do know, and there is incredible contrast in terms of what are the challenges for particular communities in different physical places, in different economic circumstances. But what we know to be true is that parents have got less time and less money than ever before.
Yeah.
And it puts so much pressure on the household and on children, when we know that so much of the relational piece is so important. And it's not just parents that are under pressure. We know that early educators are under pressure, teachers are under pressure. So many of the adults who spend the most time with children are under extraordinary pressure too. And that's the context that we're operating in. And I think that's where we, some of the work that we do at the Parenthood, I kind of frame it around, it's not just one policy change that we need, but 12 months of paid parental leave, it will just give a bit more breathing space to more households. Having the opportunity, if you need it and want it, to have high quality, affordable early education and care, amazing for what that enables in your family unit. Having workplaces that value caregiving and don't treat that as some sort of burden to productivity, but instead recognise it as an ordinary part of life. And I realise all of these things are incredibly privileged, but I think if we think about that ecosystem and we put in there the high quality health services as well, we wouldn't be solving all problems, and we cannot get away from poverty and the impact that has. But if we had some of those stronger supports there to give more families time and space, I think that would be transformational.
Yeah, I 100% agree with that. Those stresses that exist across, not just within families, but also within the broader sector as well, we have to alleviate to allow more of us to respond collectively together and do that community and whole of system work. Just to your comment, there was the mention around policymakers and the challenge between actually, you know, thinking about the lens of like love or care or all these things and actually pointing this to a public, you know, some of these things to a public health issue. I could not agree more. It was a very intentional choice in the Future Healthy Countdown for it to be a thing that is to do in like with the medical world intentionally, seeing all of the things that were being brought up across all of these 7 domains as direct health issues. And if we can start to frame that a bit more, I think there could possibly be a lot more of people coming on board and coming on board with an understanding that actually this is not effective for all of us to be in terms of our living and our thriving and our overall sense of health and well-being. So I really love that you brought that up because I'm in agreement that I think that is an important move. Even just last year, like getting to write a little bit around how education and health, there's this weird unnatural divide that exists between these two systems. Why is that the case? But they're so inherently tied together, and people going, oh, actually, I didn't realize that. And then start to bring up their own experiences and understanding that, oh, these two things are not separate. That kind of conversation does need to happen across the whole system. And there was the comment that was also made around complexity. And what I think we should embrace complexity, not as a negative sometimes, because sometimes when we see communities as complex, to your point, like it's, you know, we miss them. You know, rather actually lean a little bit more into complexity. And there's a lot of work in New South Wales that people have been writing about around complexity theory and actually being okay with that in our service system, broadly speaking. But the other thing, I guess, with when you respond to communities that are most at the margins, you will have a trickle down response to the broader community. How are we designing for those at the margins, to your point, is really, really key and the takeaway I think we should all have in the policy landscape.
So, thanks. 1 in 5 children used to die before the age of 5. And then somebody set public health outcome, no more preventable child deaths. And they introduced primarily four interventions that we now completely take for granted. Vaccination against the 5 preventable diseases, breastfeeding promotion, growth monitoring from birth, and prevention of diarrheal diseases. 4 things. And when they introduced those 4 things in different health systems, there was a lot of pushback because people thought loads of other stuff was important too. What Ezra Klein calls the everything, everywhere, all at once approach. But they said they won because they said these are the 4 things that the science tells us right now will get the best results in preventing child death. So let's do these 4 things right now. Let's measure up. But the public health approach is not just about health. It means you have a baseline target and an outcome. And so you've got a baseline now. You know, there's the vaccine coverage maybe 20% in the world in 1980, and they had a global campaign. They increased it to 80%. They reduced child mortality by 61%. Millions of children are alive this year, born this year, and every year because somebody had the courage for that focus, sequence. We will prioritize this now. It will change the way we think about child death, and then all of the other stuff will follow. So if we could do 4 interventions right now and make them universally available, culturally adaptable, but universally available, better parental leave, universal access to evidence-based parenting programs within the MCH system from before delivery, universal access to preschool, and really high quality relationships from preschool all the way through to the end of education throughout childhood to ensure secondary attachments, because it takes a village. In evolutionary biology, it takes at least 4 people to raise a child, but our economic circumstances don't allow that. So 3 or 4 things, focus, sequence, prioritize, make those happen, because progressive ideas, and this shouldn't be a progressive idea, this should be a cross-constituency idea. Children shouldn't be at the center of culture wars or polarization. It should be cross-constituency. All of this drives conservative and liberal outcomes in equal measure, but we need to have that focus because progressive ideas or ideas that progress humanity currently break down because people cludge lots of other outcomes on top of them. So we need to have that focus and sequence like they had in Glasgow, and it delivered results.
Thank you. Brilliant. You can see some of CPD's kind of work and recommendations on people in place behind us. We're very fortunate to have Zoe Witten, who's going to come and summarise the conversation for us. Zoe is CPD's board chair. She's also a real expert on just transitions, climate finance, is on the board of the Net Zero Economy Authority, and also a UN Youth Delegate, but a different type of UN Youth Delegate. Yeah, we really want to hear from you, Zoe. Thank you to wrap this conversation up, to pull out some of the ideas. There's a microphone right behind you. Yeah.
I'm going to turn the microphone on. Oh, we've got more
Another
water.
glass.
It's like the experience
thing
of
we
this event is walking on water. That's what we're doing. I'm not going to stand up, but you guys can hear me. I'm a mysterious voice at the front.
People online can't see you anyway.
Can they not?
No.
They can hear me though.
Yeah.
I'm a mysterious voice.
Okay.
The other thing I'm going to do is sit in front of you awkwardly on the stage, and that'll be strange. So, thanks for participating today, guys. This is CPD's Policy Exchange. We do this semi-regularly. This used to be a speech, and every time we had the speech, we would have 100 meetings around the speech, and then we realized actually that having a bunch of conversations and 100 meetings was a better way to run this. And so thank you for participating in the Policy Exchange, and please come again. We at CPD like ideas that change how we think about what a good society is and how to reach it, and what it is to make our part of the world a really lovely place to be, and a useful and a safe and a productive place to be. And so we found Ben's work, and we were drawn to it because it is a transformative idea about what could make our place an even better place to be. Ben, you've just talked about the mortality revolution, and you talked earlier about how Ben has this great anecdote he hasn't used today, which is asking a crowd in the US what the one piece of new science was that was going to do the most for human well-being in the 21st century, and a whole bunch of people saying Ozempic and AI. But of course, the answer is the science of attachment, which we've all been talking about. And that sort of revolutionary idea and that ability to sort of change how our society is going forward really attracted us. It's personal, but it's also very, very systematic. I'm an economist, so I went from one to the other very quickly, and I love the fact that they're both there. And we are, interestingly, bearing the cost of not dealing with this or not knowing this now. We're already bearing it. It's not in the future. It's not something we're trying to avoid. I've lost my voice. Here we go. We're back. It's something that we're bearing now. And one of the most striking and promising things about Ben's work for me is actually the 62%. Why is 62% a number like that such a good number? It's because this isn't a unique failure. In fact, as Ben, you've said, it's a transmission of a lack of knowledge about how to parent through a community. It's not strange, it's not exotic, it's not a judgment, it's normal. But to Georgie's words, we actually have a manual, but we tend to hide it. So the 38%, the other side, have that manual. How can we get that manual to everyone is the question we're talking about here. We've heard some fantastic commonalities actually in this conversation and over the conversations we've had in Melbourne, in Canberra over the last few days. And they include, Georgie, you talked about universal but not uniform services. Angelica, you talked about those services and supports having to go across domains. It's not just about child development. It has to be about economics. It has to be about employment support. It has to be about development. It has to be about health. It has to go across systems. Ben, you always talk about front-loaded. Front-loaded, front-loaded, front-loaded. Start early. Don't intervene later when it's gone wrong. And we have talked about, Richard, community embedded so many times, and you gave great and emblematic example of that. So these are some of the things we see coming up again and again and again in these discussions. A question which is kicked around, which one of our board members put forward, he got sick and couldn't even come, but he's been present with this question, which is, what if early childhood support was considered national infrastructure? Like defense, like transport. At 11% of GDP, it is national infrastructure. It's just national infrastructure we don't have. And I know everyone here is interested in changing the thinking around that. And Simon, you talked about it being a moment. We've got a moment for this. I have bored the team with a case that I think is really emblematic of this, which started when Martin Seligman became president of the American Psychological Association in 1998. And at the time, mental illness was something that you saw on television or in prisons. That was where people thought mental health happened. It was psychopaths, it was exotic conditions. And they ran a campaign to, at the time, mental health issues were prevalent right across the community, but you were not allowed to talk about them. You had ways of dealing with them, but you weren't allowed to engage with those ways, and everyone just hid it. And, you know, you had family violence and all the other stuff as a consequence. And they ran a campaign to try and transform and destigmatize the idea of mental illness and turn it into mental health. Part of health, part of schooling, part of everyone's infrastructure. That campaign's not finished yet, but it's an extraordinary example of destigmatization, of lifting something into national consciousness. We talk at a national level about mental health of our teenagers, particularly at the moment, and we're not ashamed of doing that. And that swept through, to Ben's point about focus, 1,000 different interventions and 1,000 different needs, and it brought them together to say mental health is national health, right? And similar in this case, our children are just us as a nation. In the past or the future, they're us. And so the development of our children is the development of us. So thank you for joining us. CPD does its work by bringing these conversations together. Like we're not effective without you. So we are going to keep working always, and we want to keep working with you to change ideas about what makes this a wonderful place to be and live and a great place to grow up. Thank you for being part of this conversation, and please stay part of it.
Thank you, Zoe. Let's please thank all of our panelists. Also, a massive thank you to the CPD team who've worked really hard to pull off these events. Paul Ramsey Foundation, who obviously have housed us here. And can everyone pick their glass up before they move? Pick your glass up, and we're all going to go and have lunch out the back. Thank you so much. Thank you.